Idayat, we are now taking part in the same project, a project about the Sahel, and we should have met in person a long time ago, since this project has been running for a while. But due to the pandemic, that has not been possible.
I think it's interesting that with the pandemic, we are stuck at home, working at home, and that's why I've not been to Norway in a while, actually. So it's been an interesting period, considering that for months we have had to keep the office closed, and we just commenced skeletal work at the office, with some people working at the office, people like myself working from home, and other people who have health challenges are now having to work from home. Our lives are no longer the way it used to be, considering Africa, where we are very warm sets of people, Nigerians, for instance, where we hug ourselves, we kiss people. It's been quite difficult that we cannot hug our friends, we cannot visit homes, we can't have the big parties which we are famous for, really. Although things are gradually returning to normal in Nigeria, it's almost as if there is no longer COVID-19, and that it's fast gone, as people can be seen on the streets going about their daily lives without wearing their mask or even practicing social distancing. So it's quite interesting time, considering also that people are not dying on daily basis. We are not getting the kind of numbers that we get in other parts of Europe and America. So something interesting must actually be happening on the African continent.
Right now, what I'm concerned about is more the indirect effects of the pandemic. And how is this whole thing affecting the Nigerian economy? With regard to anything from the bankruptcy, companies, oil prices, but also ordinary people, unemployment, informality. What is happening, Idayat?
The lockdown and the social distancing that was initially introduced completely crippled consumption. So the ability to buy, the ability to consume, the ability to invest were all immensely affected. So if you look at investment came up to zero, and up till now there is actually no incentive to invest, where you have treasury bills, fixed deposits at almost 1% or lesser than 1% interest rate. The crash in the stock market also completely crippled economy and declined not just growth, but the ability to spend, so consumption. Now, while all those are big, the way it has impacted ordinary Nigerians is far and above. So the unemployment that it is occasioned is unprecedented. So we talk in terms of a projection of like 27% unemployment. Now we are thinking of over 34% unemployment, made up of hugely a youthful population itself. Now, when you are even thinking about that unemployment, don't forget that most Nigerians are actually underemployed, or they are actually in the informal sector. So all the informal sector itself was completely crippled and still remains crippled.
Lately, there have also been quite huge demonstrations in Nigeria, not necessarily related to this, but I would assume that these demonstrations that we have seen against police brutality and so on, they are also a manifestation of general discontent among the population.
If you look at it with what is happening with the mass protests, the recent protests, which most of us see as a positive thing to happen, it's not just a protest against police brutality, it's a protest against bad governance in the country. And it is a protest which was led by young people who are immensely affected by the unemployment that is prevalent in this country. They are immensely affected by the unemployment that is actually prevalent in the country. So these are like real realities that we have to deal with as a nation. And I think some of the things COVID-19 actually brought out, which going forward Nigeria will have to rethink, is how the federal system itself is working, the weakness of the states at all levels, the lack of infrastructure, hospital, medical infrastructure became very, very obvious. And beyond the very frail medical infrastructure, the fact that we have fewer doctors, nurses, but most importantly, primary health care workers, whom were never priorities in this country, became very obvious to people. So when you put that together with the unemployment, with most of what happened with the protest was actually bound to really happen. The police brutality was just an opportunity to galvanize around a grievance that unites every Nigeria, irrespective of their class, poor, rich, old, young.
So it seems to me that this is sort of coming on top of an already existing crisis of bad governance, if you like.
For the first time in Nigeria, the private sector stood up, because while we are big on philanthropy, philanthropy for us means what the individual does. There are very few Nigerians who have, like the Rockefellers of this world, the Ford and all these, maybe the Dangote, Lumelu, and very few. It's very individual. But for the first time, we saw the private sector come together to also establish a fund to support some of these, some of the COVID-19 response itself. So brought together, they've been able to infuse borrowing, government fund, and private sector support, donor support also. Nigeria has been able to respond, but at minimal level, because I think the challenge is not what we are dealing with today. The challenge is something that is endemic and systemic, that's trying to find a solution to hit using the pandemic as a basis will just be like a tip of the iceberg, because we are dealing with systemic issues. So the palliative sharing at a point in time was just giving food to households. The food were just very meager, extremely meager, and it contributed to the people believing that COVID-19 was not real, that this was just an attempt for the government to enrich themselves, privately enrich themselves, as usual. And social distancing, of course, is things that we don't know, especially if you are poor. What is the meaning of social distancing when you live in a very small room with like 7 people, or at times up to 15 people? So ability to social distance, ability to say that you are shutting down or a lockdown becomes really ineffective and possibly counterproductive, because if you had gone to your informal sector, you will have the fresh air, open air to actually operate from, rather than being clamped together in a small room containing like 7 to 15 people itself. So the response itself did not really help. And now that everybody is fine, people are not dying the way it's actually expected, nobody really believes in COVID-19. Then the other question, the elephant on the table, is that moving from the pandemic, what is the plan for the future? How do you deal with some of these existing structural issues? For instance, the Nigerian middle class goes abroad. Now, we are not talking of the rich, the nouveau rich. The middle class goes to different parts of the world for their health. So if they are not able to go to the US or the UK, they're able to afford Dubai or India, Egypt. All of a sudden, everybody was stuck in the country. So how do you build the healthcare system? How do you make important the local government structure, which is the most important structure, which would have really helped in terms of the COVID-19 response, in terms of public education, in terms of tracing of the infected person, in terms of the primary healthcare system, which are largely concentrated in the local government areas. Now to the issue of taxation. I think the state policy for long was actually not to go for taxes. So they were not very big on tax generation previously. So like 10 years ago, the Nigerian state will not bother because it was very oil dependent. And I think it was also a strategy to shy away from accountability. So if you are not paying taxes, citizens will not rise up to demand answers to how resources are actually being spent. But again, showing state capacity with Lagos, they became a very huge tax generation drive. And the federal government became also hugely demanding in terms of their taxes again. But the taxes that are being paid are not often commensurate to the services that are actually being rendered. And there are several issues of double taxation that is ongoing. I think one of the recent work we did at the CDD was to actually look at taxation in the informal sector as it relates particularly to women. We did 2 state case studies. And it was very interesting to find out that beyond the fact that there were multiple taxes at all levels, and some of these taxes, to make it worse, are even contracted out to companies of cronies and friends, which is one of the forms of capturing the states in Nigeria. But there are also differentials amongst these women when it comes to indigenship or non-indigenship taxes. So it's quite interesting the way taxes is organized in the formal sector compared to the informal sector. So in the informal sector, you can pay taxes up to 4 times. It might not be said to be taxes, it might be park level, market level, daily tax allowance, local government. So at different stages, you have these taxes.
There is some years since the last time I was in Nigeria, but I have also visited Nigeria sometimes, and I've always been struck by both the difference between the haves and the have-nots. I've been struck by the immense level of inequality, but I've also always been struck by the entrepreneurship, the level of innovation, the adaptability and the flexibility of all Nigerians, whether poor or rich. I mean, your country is somewhat of an enigma. I mean, it's Boko Haram and deep-seated poverty. It's the second largest or the largest stock exchange in Africa. It's government mismanagement and corruption, but there is also relatively strong institutions, and you still have some of the best universities in the whole of Africa. How can all of this come together and put Nigeria on a path to recovery?
I think that really the COVID-19 is an opportunity for Nigeria. It shouldn't, where structures are working, if we had a good structure, if we had Nigeria working, it should not really have impacted us the way it impacted other parts of the country, world, considering that we are by now an expert with dealing with infectious diseases. So we had Ebola. By the time we are having COVID-19 came on board, we were trying to deal with Lassa fever. So it's so easy because all those structures are really existing. It's just building on the structures of infectious diseases that the country really had to do if things were the way it's meant to be. Now, how do we get to where we really want to be as a country? I think we really need to renegotiate Nigeria. And a renegotiation is one that will be inclusive. So people can say restructuring. Restructuring is the key word everybody uses. But what exactly are we restructuring as a country? And how are we going to be restructuring? Restructuring is not just about the north, the south. It's not just about having a state police. But who is restructuring, which the issue of inclusion comes in? How do you bring your women on the table? How do you bring the young people on the table? How do you bring persons living with disability on the table and other vulnerable groups so that they feel part and parcel of the society? How is the private sector involved actively in the conversation around Nigeria? and not just the not-for-profit sector. Healthcare is very, very key, because if by now Nigeria is now the capital for child mortality, 2 years ahead of the forecast time, where will be the future oil, which will be the young people of this country? The same way with the education system, which has collapsed. So dealing with power, dealing with electricity, dealing with education, dealing with good roads, and dealing with healthcare, those 5 core are important for the country in terms of reducing the inequality. The government will have to go fast in terms of alleviating the suffering of the people, in terms of coming up with a social structure that can effectively lift people out of poverty in the next 2-3 years maximum, really.
Thanks a lot for the conversation. I found it very, very stimulating, and I do hope that we sooner rather than later can continue this conversation and continue it not only on an e-platform but also in person, be it in Oslo or be it in Nigeria. So thank you, and have a nice day and stay safe. Thank you.
Thank you. Bye.
Bye-bye.